Patient stories can provide a valuable insight into the challenges faced and coping strategies employed by people living with CLL. They can provide comfort and nurture a feeling of you are not alone to those of us living with CLL and our families. However, the views expressed are those of the storyteller and do not reflect the views of CLL support. CLL support does not have any editorial control over the contents of each patient's story and will not necessarily have prior knowledge of the contents of a patient's story. They reflect the lived experiences of those who choose to share their story. They are personal to each individual and their circumstances.
Hello everybody. Interesting disclaimer, so I wrote my own as well, which says, these are my opinions and my understandings and my experiences, okay? So, from both sides. So, I'm Robin, and this is my CLL journey, some of my experiences, some of my thoughts, okay? So, first of all, who am I? Well, it says, I'm not going to read them all, but basically, I'm a son, a father, a friend, okay? More interestingly for you, I'm a Morris dancer. Talk to me afterwards, okay? A gardener, a traveller. I'm retired, so I retired early. Nothing to do with CLL, just happened that way. Oh, and by the way, in my mind, I also live with CLL, okay? So not as important as the other things, but nonetheless have to be aware of it. Okay, so this is the journey so far. So, I was diagnosed in June 2012, and in fact I met Adrian, funny enough, who was here earlier, in July 2012, and as if you could see the detail, I was actually treated with FCR starting in July 2012. Now, for those of you who've got a memory that rolls back to this morning, you'll remember Adrian said people don't tend to get treated very quickly. Well, I was treated about 2 weeks, as my treatment started about 2 weeks after I met Adrian, and it transpired that I'd probably been living with CLL for at least a year before then. And it was only after the first month of SCR that I realised that I no longer had back pain, and I was also only visiting the loo about once overnight instead of half a dozen times. And as it transpired, when we looked at a PET CT scan, which he had requested for me because he thought it was something more aggressive than CLL, what was the middle hair, where there was a series of lymph nodes, mine looked like one enormous one. Okay, so backache and gone to the loo a lot were the symptoms. A month after I was treated, most of that had gone away. Okay. So roll on a few years, and in 2016, I relapsed. And again, in discussion with Adrian, we looked at various options. There was the do nothing option, repeat what you've had before or another thing, or do a trial. This is ibrutinib and venetoclax for refractory and relapsed patients. Okay, so I signed up for that trial, and I'll talk a little bit about my approach to trials because I'm sure people are quite interested in that. That went fairly well until 2021, and then I relapsed again. And this graph, okay, shows my absolute lymphocyte count. And it's just an easy way to represent what was happening. The very first time I met him, Adrian said, I'm not treating the numbers, I'm treating the patient as a whole, okay? If you wish to track the numbers, that's fine, but they're only part of what happens. This is just an easy way for me to visualize sort of what's going on, okay? So in October 2021, it was fairly obvious that I was relapsing, and we had a number of discussions. Would you be interested in doing another trial? There's a thing called CAR-T. So would you be interested in doing that? And in fact, I've been reading up about CAR-T, and that was like, yes, okay. I wanted to say yes immediately, but he pointed out I needed to go away and think about it after we'd had a discussion. So I went away, thought about it, and said yes again, okay. So, in fact, in May 2021, May 2022, I actually had CAR T therapy. So I'm going to talk a little bit about now my reasons for doing a trial. Well, I sat a number of times in his office or in the office of one of his colleagues and talked about what I could do. I could do nothing. That's going to end up in a bad place, was my opinion. Okay? I could repeat something else that I'd done before or a standard treatment, or I could go on a trial. Well, my background, if you noticed, was in IT. And one of the things I used to do was do early support programs for products that weren't generally available. And you'll realize that that's quite similar to a trial. And basically what I'd learned from that was there's a lot of extra effort put into managing what's going on, monitoring it, etc., to make sure there isn't a bad outcome. So this worked really well for me in my brain. Okay? So the benefits were I got early access and I got a tailored treatment. Okay, tailored treatment because they were going to take something from me, modify it and put it back. Okay? And I thought that was possibly my best way forwards. I'd already been treated twice with ibrutinib, venetoclax, fludarabine, cyclophosphamide, and rituximab. So that was how I made the decision, really, to move forwards. There were possible side effects, and those are well documented normally in the trial documentation, which I did bring a set of trial documentation here. It's only about 20 or 30 pages, but it's important to have that and go through that thoroughly. For CAR T specifically, CRS and ICANN, so one is cytokine release syndrome, so it's bad news, and the other one is a neurological problem. That's also bad news, in fact, worse news. So those were two things that I pulled out that were important to me. And another reason for doing it was I felt in the past other people had gone before me and done trials. I'd benefited from their involvement, and I felt I'd like to offer something to further people coming down the line in the future. So a little bit about give back was tick for me as well. So how did I prepare? Well, before I committed, I had to go through the documentation. I went through the documentation, I say a couple of times, 3 times, I can't remember how many times I went through it, pulling out various things. I also had somebody else read it for me, somebody who was independent of what I was thinking. It actually turned out the person I used most was my daughter, who was a bioveterinary scientist. I sort of thought having a technical knowledge would be useful, but I did check with somebody else as well. So it was useful to have a second person or a third person read through the documentation and understand what I thought I was letting myself in for to see if it matched up. And discuss it with your CLL team. That was another thing. We talked about this for, I don't know, 3 or 4 weeks, I think, on and off at various times, emails backwards and forwards, questions, until I was really clear in my mind what I was doing, what was expected of me, and what the plan was. And you need to understand the plan because you really don't want anything exciting or unexpected to happen. So the more you can plan and understand what's going to happen, the less there's going to be a surprise. It's a bit like flying, really. You don't want lots of nice surprises when you're flying. Okay, so this is, not very clear, is it? Okay, this is a page out of the Clarity trial documentation, which was the one I did in 2016. The only reason I picked this rather than the CAR T one is that it's in a tabular form, so it was easier to see. And basically, it told me what was happening on what event was going to happen on which week or which day. So once I had a start date, I could work out when things were going to do. So I mapped it all out onto a piece of paper just so I could see what should be happening when and what my expectations were. As I said, this is the one from Clarity. The one from CAR T was a bit bigger and ran over several pages, so it was easier to copy one than 3. Sorry. Now, if anybody is not keen on seeing blood, okay, not keen on seeing needles, I would suggest you turn away at this point, okay? I don't want to be responsible for somebody ending up on the floor. Right, so these are 3 photographs, and the first one is of an apheresis machine. So it looks a bit like a spin dryer if you were born in the 1950s, okay? But it's a very clever centrifuge, basically, and it splits blood, takes out the T cells, or so I thought, okay? And the blood is in the top left-hand bag, if you look at that, before anybody says, where's the blood, okay? And it's not red, it's sort of a browny color, okay? That's because it's only part of blood. Red blood cells went back in. So the blood came out of one arm, went back in the other arm, minus that bag, okay? So that was considered a success. That's 175 milliliters, and it took 5 hours. Okay, so you'll see I'll make a comment about apheresis on the next page, I think. All right, the middle chart is me. I was actually feeling fine and excited. It looks like I'd lost a pound and found a penny, actually. It's not the case, okay? But that is looks like a milk churn that my blood arrived, so my T cells arrived back in. And that was the big reveal when the nurse took the lid off, and it's kept at minus 80 degrees centigrade, so there was smoke everywhere. And in fact, at the time we were doing this, the education department from the Christie were there and taking some photos, so we actually took the lid off twice, just so they got good photos. And then the final photo is my CAR T cells coming back to me. So the nurse was putting them out of the vial, which, by the way, wasn't rattling around loose in there, okay? The first thing she produced was this. Inside this was this tiny little vial, anaesthetic. That's ridiculously small. Turned out to be 4 milliliters, or as my wife said, a teaspoon, okay? So anyway, that was put into a syringe and then put into an IV line, basically. So the whole process for the first infusion took about 30 seconds, and that was it. Okay, so those are the 3 photos that give you a feel for that. By the way, this was down the bottom there somewhere, so she had gauntlets up to here that she had to put her hand in and reach the thing out. So it was tiny. Anyway, so this is what happened in my CAR T trial, okay? So first of all, I had to sign consent. That started in December. And then I started a series of screenings, okay? All sorts of things. The first one was in December, and it went right through until quite close to the start of the trial. Apheresis, or leukapheresis, as is written up there, was, as far as I was concerned, sitting very still for 5 hours, because if you move, then it stops. And my view was 5 hours was long enough as it was. Interesting challenges during that. Lunch, one-handed, which was a pack of sandwiches. How to open it with one hand without moving this arm that had to be as still as possible. So we got there anyway. We got our 170 some odd milliliters. Then lymphodepletion happens in the day -6 through to -1, and day 0 is actually the first infusion. So cyclophosphamide for 3 days, cyclophosphamide for 1 day, 3 days rituximab, and then 2 days of rest, and then CAR T. And the objective of all of that is to push your count down low. If you remember what Adrian said earlier, with a low number, you tend to get better results. So they wanted to push it down quite a long way. So they did that. Because I'm a CLL patient on the trial I was considered high risk. So instead of getting all the T cells in one go, I got a small sample, 4 mils. 9 days later, I got the rest, which turned out to be 23.4 mils. So it wasn't exactly a lot. And again, it took less than a minute to infuse. Then 28 days of monitoring. You're in isolation for most of that time. and basically daily testing, sometimes every 4 hours. It varied. So what I brought away from that, however, was it's 28 days of isolation. You need plenty of entertainment, reading, music, anything. Daytime TV, bad idea, okay? Bored within minutes. You also get to exercise, and the room that you live in, or the room that I was in, was 42 steps around the outside, okay? You don't walk many miles doing that. You soon get fed up. Anyway, so that was it. The initial monitoring finished at day 28, so cell infusion 1 is day 0. If I look back to my ibrutinib and venetoclax, it was about 14 months through before I became MRD negative. Okay, everybody's familiar with that term? Yeah, MRD negative, yeah? Okay, on day 28, I was MRD negative already. So there you go. Continued checkups, getting further and further apart, okay? So from cell infusion 1 through to the end of the first year, I had 7 bone marrow biopsies, okay? You get used to it. Well, okay, so I would rather have one than go to the dentist, was my view, okay? And it's who does it that counts. Anyway, so I have long-term monitoring now, which is once a year for up to 10 years. So that's quite good. At the moment, my lymphocyte count, as of Tuesday this week, was 0.7. So that means I'm in a good place as far as I'm concerned. And the future, well, I didn't say I also walk, so the future looks bright. I can't remember the rest of the thing. Anyway, so good news, rainbow, etc., etc. Plenty of time to do my own things, including that.